Hi, my name's Nick Cross. I'm the Trust's Medical Director and I'm also the Caldicott Guardian. So what is a Caldicott Guardian? It seems a bit of a strange name, doesn't it? But actually it derives from Dame Fiona Caldicott, who created some recommendations into how we as an organisation manage patient identifiable data. And so my role is to essentially ensure that the organisation treats any patient identifiable data that we hold legally and ethically, and also ensure that we maintain confidentiality. And that's really important, isn't it? It's important from a public perspective, because when they're handing over confidential data, they need to know that it's been used appropriately, stored appropriately, and also that it's treated confidentially. If they haven't got that assurance, then actually that's going to create problems with trust. The second thing is, it's important from us from an organisational perspective, from a medical legal perspective, because when these things go wrong, big problems can arise. And also it's important from your perspective as a user and somebody that accesses data on a daily basis. These systems and processes and principles are there to help protect you too. So I'd like to, if I may, just concentrate on the principles that Dame Fiona Caldicott created. The first one is you need to be able to justify the purpose for sharing data. Where we can, we need to be sharing data, especially if it helps improve patient and service user care. But we need to be very, very clear that there is a justification of purpose. The second principle is only use personal confidential data when absolutely necessary. So if we can keep things anonymised, it's much easier. We're not breaching that confidentiality. The third principle is where we do need to share personal confidentiality data. Let's keep it to the minimum personal data required, rather than revealing a whole host of things that possibly aren't necessary. So the fourth principle is access personal confidential data on a strictly need-to-know basis. So you need to be very cautious about your conversations that you may have informally with your colleagues about particular patients. You need to be sure that when you're accessing patient confidential data, that it's on a need-to-know basis. The fifth principle is making sure that everybody that can access that personal confidential data is aware of their responsibilities. You know, this is one of the reasons why we're so keen that everybody goes through the relevant IG training. It's really important because that lets you know that what the responsibilities are upon you as individuals, as well as as organisations. The sixth principle is we must ensure that we understand and comply with the law when we're processing confidential data. There are a whole host of laws, from common law of confidentiality to GDPR, and actually these are really important in the statutory, and they're there for a reason, but we need to make sure we understand them and that we comply with them. And the seventh one is an interesting one. This is that the duty to share information can be as important as the duty to protect patient confidentiality. Interestingly, we did an audit which basically we were seeking to know what people's thoughts were about and understanding was about the Caldicott principles. Some of you may have had one of these questionnaires, and actually point 7 was the one that caused people the most problem, knowing when and when not to share patient confidential information. And it can be tricky, and some of the cases can be really complex. But you know, if there are any issues that you have, any problems that you need to discuss, myself as Caldicott Guardian, our data protection officer or ICIRO, would be happy to discuss those particular issues to help support you to ensure that you're able to meet all the Caldicott principles.